Speak to us a little bit about rehabilitation. I believe we have a graphic for that as well, so that we can talk about what rehab should do and what kind of rehab can you start doing on your own.
Yeah, I think one of the movements we've seen nowadays is really early motion. Okay, but it's somewhat protected motion within the plane that is a safe plane.
So I don't want to be on crutches all the time. Not like keeping off like what we call non-weight bearing. That's not necessarily the best idea.
Exactly. I would say oftentimes I let the patient kind of dictate like what their tolerance level is for the pain. So if they need crutches at first, then we usually will let them do that. But as quickly, soon afterwards, we want them to be able to put weight on it if it's an injury such as grade 1 or 2. And then also like I said, protected motion. So in a certain plane, we may not want them to be inverting their ankle initially.
Okay.
But they can still move it up and down. Okay, so we may have like a small brace or something for them to protect them, or a boot if it's a more severe injury.
And when they're actually in a physical therapy program, that tends to be pretty more elaborate than most patients perceive before they go to physical therapy, correct? So if you can give us a few about that. What would you want the physical therapist to work on?
Yeah, and initially in, let's say, the initial phase, we'll have the therapist work with you in terms of reducing a lot of the inflammation that you have. So using ice or other methods to really reduce that inflammation is important early on. And then following that, as let's say the ligament starts to heal, if it is a ligament tear, then we'll have them start doing strengthening exercises and then balance exercises, what we call proprioception. It's a big word, but it's essentially your sense of where your body is in space, like balance. So these are things I think that would be helpful long term in terms of either prevention of other injuries and keeping you out of trouble.
Okay, great.